Hey folks, welcome back to another episode of The Change Physician. This is your host, Dr. Kevin Cuccaro, with my wonderful co-host, Dr. Melissa Cady, and our returning guest, Dr. Brad Block. As you all well know from his previous episode, Dr. Block runs that fantastic podcast, Physician's Guide to Doctoring, where they talks about soft skills that all physicians need in their practice and in their lives. So for this episode, particularly given where we are in the state of the world with the introduction of the COVID vaccine and all of the hullabaloo surrounding that. Some people are like, this is the greatest thing in the world. Other people aren't, but realistically, we all at some point need to get vaccinated. What are the skills that doctors need to talk with their patients, to discuss this stuff in a rational manner, how to validate their patients' experiences, but ultimately to guide people to the healthiest choices that they can. So Brad, it is awesome to have you back on the podcast today. Excited to talk with you.
Well, it's great to be here. I had so much fun the last time. I was excited to that you guys wanted to have me again. It's really it's a pleasure and it's an honor that you would ask me on again.
I'm missing your space in the background. You had that space look.
Yeah.
Yeah.
But I'll show you what happened. My wife zhuzhed up my space.
Oh.
For those who are listening, you can't see it, but I had these curtains and it was also kind of a storage area. So my wife, now that the kids are 2 out of 3 of the kids are in school, she decided to not, because, I need to start putting my stuff out on video as well, as much as I want to be a podcaster and heard, but not seen. If I really want my message to get out there, I need to be seen. So she said, it's embarrassing and we don't want you representing the family. That's not what she said exactly, but she said, I can help you make that look better. So now, the curtains are a little spread. There's some pictures in the back. Yeah, it's nice. I'm not sure you can see you got like a wedding photo back there.
Oh, look at that.
Fancy pants.
Yeah, indeed.
Very cool. All right. Well, you use those soft skills to hear between the lines when your wife was talking about your space. So what are the soft skills that you've been learning when it comes to vaccination and talking to your patients about vaccines in general and maybe the COVID vaccine specifically?
Well, so just to be clear, I'm an otolaryngologist, right? I don't give the vaccine. However, I think it's critical for all of us to be talking about it. Right now, anyone who, it's not an issue of, should I say, the demand is outstripping the supply, right? The demand is much greater than the supply. So at one point, it's going to hit that inflection point where now the supply is greater than the demand. And we're going to have to get to work on convincing those people, and maybe convincing is the wrong word, and you'll see why, convincing those people who are on the fence that it's really in their best interest and their family's best interest, the community's best, like everyone's best interest that they get vaccinated. And so I bring it up with most of my patients. Doesn't help my schedule move along as smoothly as it often does. But I think it's critical for all of us to be bringing it up with our patients. And there's a few right ways to do it. And then there are, all the other ways to do it. And so one thing I've been covering on the podcast is different approaches. So I interviewed someone who is a science communicator, actually 2 science communicators. One who does more misinformation, one who has a background in health communication, someone who does more sales, right? So we were talking about this, Kevin, before, someone who does motivational interviewing, and you notice the difference between, or rather the similarities between motivational interviewing and sales, cognitive biases, legal issues, right? I just had an episode where we talked about the possible vaccine mandate, and I'll give you the short version of that. It's unlikely that there's going to be a vaccine mandate in a hospital or any type of workplace or school while there is, while it's under EUA, while it's emergency use authorization, because that'll really put you in dicey legal ground, because it's not like an established vaccine. It is new, and so it was authorized for EUA, and so you can't really mandate something that's authorized for EUA. So we cover a lot of different angles of how to best talk to your patient about it, and there's really been a common thread among all these different methods, and that is shut up and listen. Right? Ask and sorry, Melissa, you had put up OARS, right? From motivational interviewing. And so the first one, what was that? It's open-ended questions or?
Yes.
Yeah, open-ended questions, right? Actually, I haven't done the motivational interviewing one yet, but I've just been reading up on it before the interview. Open-ended questions. So if you want to talk to your patient about it, the first thing to do would be, what are your thoughts on it, right? Just ask them about it. Just ask them. The worst thing to do would be to say, people don't like being told what to do, even though they're coming to see you as a physician because you're the authority, you're the expert, right? That's why they chose you. But at the same time, they chose you to help them make a decision, not make the decision for them. And so it's important when you're discussing the vaccine with someone who might be hesitant to, or anyone for that matter, like open it in the least judgmental way. So what are your thoughts on the vaccine? Just open it that way and then go about the conversation with as little judgment as possible.
Yeah, it's interesting because if you're like, you got your vaccine, didn't you? Right?
Yeah.
If you start it that way, it's like that whole shame game. Not that any of us have ever. I mean, I know I've probably done something along those lines, not necessarily for the vaccine, but in some other realm. But you never know where their fears or their anxieties or something that's driven, behind that. So I'm glad you brought up the open-ended question, shut up and listen.
Yeah, I've definitely asked people that I know work in healthcare so they have access to it. So have you gotten the vaccine yet? Which is, the assumption is that they should be and they will be getting the vaccine, right? Like what's taking so long, rather than do you plan on getting it? I think that's another way to ask. And then that opens them up to explain to you their feelings on it. And it's important to then validate their feelings. The last thing you want to do, if the minute you dismiss any thoughts that they might have on it, you've lost them. And you've probably lost them as a patient.
Yeah.
Right? This might have been someone who's new to you, or it might be someone who you have a long relationship with, and they'll, probably tolerate a little more dismissiveness just because they know you better. There's depth to that relationship. But if you dismiss their concerns, then
they'll dismiss you.
Yeah, then you're done. They'll find someone else.
Well, that's such an important point, right? Because there's a different spectrum of relationships, and when you are a physician, and particularly in this space now where we are with the pandemic, we're going to be seeing a lot of new people, and there's going to be a lot of new interactions with them. And until you know who they are, having that open-ended question and giving that safe space to respond is really, really crucial. You brought up the psychological reactance, like we hate to be told what to do. And it's so bizarre because we do that, we have a tendency to do that as physicians, but then I'm always thinking, well, when someone does that to me, I hate it. Like I can't, I sometimes just want to say no, even if it's something I want to do, because I have like a huge reactance profile. Like I hate it when people tell me what to do. But
yeah, it makes them do the opposite, right?
Yeah.
It makes them dig in. It makes them want to defy you. What is it about being a human being that when we're told what to do, even by an authority that we came to, that if they tell you what to do, you're more likely to want to do the opposite? It's like talking to my kids.
Yeah, and you paid money to see them.
Yeah. But there it is. I mean, like I recommend that you take antibiotics and steroids for your sinus infection is a little different than you have to get the vaccine. You need to get you don't understand how important this is. You have to get it. It's tough. It's tough because this is what we're trained to do. We're trained to tell people what to do.
Yeah.
So we have to get in the habit of phrasing things a little more openly, especially with something like this.
Yeah. So I wonder what you think about this. Like if someone was to say, whether it's the vaccine or something else, if you phrased it as, I have some ideas, these, there's so many options, if one is this, number two is this, number three is this, what do you think about that? Is any interest in, does any of them appeal to you, or what do you think? Instead, I probably shouldn't say that. What do you think about all these options, and just let them kind of, dig into whatever they want to dig into? How do you deal with that, giving options?
You mean in terms of not
Like
in
if
terms
you
of the
had-
vaccine, because right now it's the option
Yeah.
is take it or leave it. Right.
Right. So I guess kind of frame it like if you had children and you want to, instead of telling them, you know, don't ever drink alcohol or don't, you know, relationship stuff, whatever, instead of telling them don't do this, you just say, well, if you were to say get the vaccine now, and you know, these are the things the pros and cons. If you were to get it 6 months from now, these are the pros and cons. If you didn't get it at all, these are the pros and cons, things that could happen. So you kind of like frame the kind of the cause and effect or potential, you know, I guess pros and cons to it, so that they can reflect on that and decide what makes the most sense for them. That's what I'm thinking.
Yeah. Yeah. I think it's important to give them, like we do with their kids. Do you want to put on the red pajamas or the blue pajamas?
Give them choices.
They give them a choice, even though ultimately you just want them to put on pajamas. Just put on your pajamas. Just put on, but yelling at them, put on your pajamas, right? Doesn't work as well as, do you want the red ones or the blue? So I mean, it seems a little patronizing, but you know, I think the onus is on us as physicians to really guide the patients in the direction that we think, but at the same time, guide them, right? As we've been saying this whole time, guide them and not tell them what to do. But you know, I think you explained it beautifully. Like, if you choose to get it now, right? This is what we've seen from the vaccine. This is what we know. If you choose to get it a few months from now, because you said you wanted to see, because this is what we're getting, right? This is what our patients are telling us. Well, I just want to give it a little time. I just want to give it a little time. I want to see. Ultimately, what they're doing is they're avoiding making the decision. The decision, you know, not to act is the decision. So instead of them, they think they're deciding to wait, but they've decided not to get it without the guilt of deciding not to get it. And I think it helps to know that they've done that. I don't know how much it helps to explain it to them that way. But explain to them the risks that they're taking, right? Like if you choose, as you said it, if you choose to delay it, right? And I think it's important to acknowledge that, right? When I got my vaccine, this is what I tell my patients, I was nervous about it, right? It's new. Not only is it new, like I was one of the first, I don't know, million people to get it, right? And so I wasn't in the study, right? Those people were certainly braver than me, but I was nervous. And by telling them that you were nervous about it, they can identify with you more, right? So I'm not telling you to lie about it, but you know, for me, it wasn't a no-brainer. I had to give it some thought, and ultimately, the more I thought about it, the more it was a no-brainer. But still, you know, it's new. There's some anxiety. So I explain it to my patients that, yeah, I was nervous about it. I was definitely nervous about it. It wasn't such an easy decision. Now, all of a sudden, they can identify with me. All of a sudden, their trepidations, they now see in me. And then I can talk them through how I made my decision, but then I can explain to them the risks of delaying, right? If you do decide to wait, there will be, you know, a few more million people that get it that we can track to see if there are any untoward effects. But there are a lot of effects that we know from the disease. So the more you delay in getting it, the higher risk you are of getting the disease. And these are the risks that we know of the disease, right? So the decision is not to vaccinate or not vaccinate. The decision is more to vaccinate or get the disease.
Yeah, and I wanted to pull that out because that's I think I saw you post somewhere and I was like, this is just absolutely beautiful, because it was almost framing the question in a different way of vaccine or not vaccine, you know, getting the vaccine or not getting the vaccine. It was really a choice of, do I want to get the vaccine or do I want to have increased risk of the disease? And so by framing that question in that way, you're sort of avoiding some of the battles that are inherent with that. So now it really truly is an apple to oranges comparison, but the brain doesn't necessarily take it that way. It just sees it as two choices and it wants to pick the one that sounds better. Yeah. So no, I love that. And the other thing that I really liked, since we're talking about kind of these framing these choices, what Melissa brought up is, if it seems almost safer if you bring up, you know, would you like the vaccine now or would you like it later? There is a sort of a soft commitment to that, because if they say, well, I would like it later, they're in some way saying, well, at least I'm interested in the vaccine. So then we have a commitment and consistency thing. Right? So they're taking that short little commitment step. And then later on, when you're talking to your patient and say, oh, you remember that it's March and we have a new stock of vaccines available. It sounds like this would be a better time based on our prior conversation for you to get this, if that, something like that, where you're looking at how you're framing those questions in such a way that it's not a simple hard yes or no. Do you want the vaccine or no? Well,
even better. If you, as their pain physician, say that to them, right? And get them to mentally commit to being okay with it. I'd rather get it, but I'd rather get it later.
Mm-hmm.
Then whenever later is, and their primary care physician has it and asks them, well, their pain doctor has already discussed it with them and they've already kind of processed that they're okay with it. And then it'll make the job much easier for their primary care physician, right? Because we're all in this together. So if they hear it from me and then they hear it from you and then they hear it from their primary care physician, all of these are nudges that put them. And I think it's important to recognize that it's not, we're so used to success or failure, right? Like, it's binary. It's not this isn't binary. We're trying to just nudge them in a direction. And it's not, if they don't get the vaccine that day, let's say you are someone who's giving the vaccine. If you don't convince them that day, either you will have another opportunity or someone else will have another opportunity, and you don't want to burn the bridge. You want to just leave it open. Like you said, Kevin, you don't have to get them to commit that day, but if you get them to mentally commit to just being okay, yeah, I guess, you know what? Yeah, you know what? I would be okay with it. I would be okay with it. Now that you put it that way, I'm not right now, but I would be okay with it. And then that should be good enough, because, the enemy of good is better. You keep on pushing them, and you might get that psychological reactance where they end up digging in and be like, no, you know what? You ruined it. You had me. You had me at hello. And then
we got the downside of commitment with that, right? If you have someone, if you structure the question in such a way that you get a hard no, that person has now said no. And so to remain consistent with that type of behavior, they're more likely to say no at a future date. So I guess that's something we should probably be avoiding here, is avoid hard no's when it comes to the vaccine, because that's going to make our downstream work even harder than it was now.
Yeah, leave it open as possible, which is where the lack of judgment is important when asking them, right? When asking, what are your hesitancies? What are your reluctances? What are you worried about? Why? And then another thing that I learned from one of my episodes was there's all this misinformation out there. And one thing that you really don't want to do is you don't want to teach them more misinformation, because if you bring up like Bill Gates and microchips and it changing your DNA, like in someone that hasn't brought that up, I mean, if they ask about it, I think it's important to have some, science in your pocket that explains in a basic way. And the more you can make it in like a fun way, because conspiracy theories are appealing, right? They simplify the world. They simplify a complicated world. But one important point is to make sure that you, when you're explaining the science, try and make it, a little more palatable, a little more enjoyable, maybe an analogy, and then definitely don't plant any seeds of misinformation, because if they didn't hear that, even though you're framing it in terms of this is misinformation, they're more likely to believe it if they hear it than a second time. You're really planting a seed. So don't tell them more misinformation. I think I might have made that mistake a couple of times. Man, you should have heard this other one that I heard. And then,
well, it kind of reinforces that mistrust, hesitancies when you hear those conspiracy theories and whatnot, especially when you get repeat. I wanted to make a comment from what you'd said earlier about how you prime the individual, even if they may not make the choice right in front of you. It kind of reminds me of, not just marketing and psychology of, sales. The more that people get exposed without it being forced on them, it's kind of like a passive kind of, method. It also is kind of like with someone that wants to quit smoking, where if you just have the conversation, obviously you need to connect with, you have to have a rapport, and show that you're really interested in kind of where they're at with everything. You may not be the person that gets them to quit. It's a process of understanding, exposure, comfort, trust, and all of that. So I just wanted to reinforce that, because I think that's really true. You just prime them in a positive way so that as a community, we can help us make good choices. But
Yeah, no, exactly. Trust. I think trust is hugely important, right?
Yeah.
Trust is, might even be, how you can frame it to yourself. Like, I'm not trying to convince this person to get the vaccine. I'm just trying to build trust, right? And how do you build trust? By being an empathic listener. Like, you're not telling them what to do. You just want to listen to who they are and where they're at and build that trust. And then, you can build from there. But I think you make that Melissa, that's an excellent point. Trust is, there's a lot of distrust of the medical establishment. There's a lot of distrust to doctors. There's, and the more that we can do to facilitate trust, one patient at a time, the better off we're all going to be. It makes our jobs a whole lot easier.
Yeah, and that's probably another topic, because I think there's a bitterness at the cost of healthcare that comes through in our interactions with patients. I don't think they always realize that that's a component probably playing into it.
Yeah, especially now at the beginning of the year with new deductibles.
Yeah.
I've had a couple of those conversations already.
Painful.
Yeah. I wanted to just call out one thing else, Brad, that you said that was really, really cool, is no matter who you are in the health space, and we're talking predominantly to physicians here, what I like is that you as a specialist are sort of paving that road, because that's a beautiful way for everybody to work together. Because if you're not on the front lines administering the vaccine, what is it that we can do to make a difference as a specialist physician, where you're building that trust, and may not be necessarily trust with who their doctor is, but trust in the process itself. So I hadn't even thought about that. So I just want to make sure that we talked about that again, or at least amplified it, because if you are not one who is administering the vaccine, you may not think this is relevant to me. And as you've eloquently stated throughout this, actually you are. Each of us has a role to play in this. So I really appreciate what you're doing with that.
Yeah.
I actually heard that from Gretchen LaSalle, who wrote a book on vaccine hesitancy. And she said, so I totally took that from her. It's up to all of us. Like, if the patient hears it from their ophthalmologist and their urologist and their OBGYN and their pain physician and their otolaryngologist and the emergency medicine doctor and the anesthesiologist that's about to, maybe not the anesthesiologist, but, the interaction is so brief, but, or their pathologist or their radiologist, people they don't necessarily talk to. But the more we can just keep nudging people in that direction, keep nudging, the more people are going to feel comfortable doing it. And also, what we've been saying, if you focus on building trust and not about telling them what to do, they're going to, it's going to be something else that's going to get them to become your evangelist, right? And recommend their friends and tell their primary care physician about you. And, there's clearly a lot of benefit to that.
Yeah. Even if people aren't directly talking to a patient, they can play the role in getting vaccinated themselves. So they're part of that coverage. So at the very least. And
actually that's, I had someone on the podcast talking about cognitive biases. And so there are a bunch of cognitive biases that the anti-vaccine movement uses, like natural is better. And conspiracy theories are part of that. But to turn that around, I asked, what are the cognitive biases that we can use to our advantage? And one of the things was the bandwagon effect, which is, the more you see people do it, the more likely you're going to be comfortable doing it. Yep. So this is where all the healthcare workers putting their, COVID shot on social media, it seems corny, but I've been telling my patients, the ones that are like, oh yeah, I'm definitely getting it. The one thing I ask of you, tell everyone about it. Tell everyone you got it, because the more people you tell, the more comfortable they're going to be getting it. So it's important for us, the authorities in the field, to make it public and let people know, but it also helps if they know that their neighbor got it and their teacher got it and their auto mechanic got it. And all these other people are like, seems like most of the people I know are getting it. And these seem like reasonable people, they're going to be more inclined to get it. So using the bandwagon, using cognitive biases to our advantage, it doesn't seem, I don't think it's like nefarious. Oh, we're trying to manipulate people, but it's just,
it's encouragement.
We're just showing how proud we are that we got it, how glad and relieved we are we got it, and we want other people to feel the same way.
Yeah, just in case you post anything, you might want to just expect that there's going to be I don't want to say haters, but some people that are anti what you got done because they have a bias on another front. So you just have to kind of take that with, the post. You'll get more positive than negative, but you will sometimes get the negative too.
Yeah. They feel threatened. They feel threatened by the fact that you got it. And if you are a physician listening to it, you're an authority, and they take that as a threat to their identity.
Yeah. And, if they feel like you should know what they know, sometimes they want to, push that too. So
what do you guys do when that happens to you? Like when people engage with you online in a negative way? Has that happened?
Not really. I kind of diffuse things in a way it's very neutral, or I will say I'd love to see, the evidence. Feel free to share it.
I had it happen and it was not pleasant. Yeah. and
I think Kevin's experienced
it had to do with like some state legislative processes, and then you're stuck in this realm where you feel I didn't know how to respond because we were being told from the state you couldn't say anything, so it was not fun. It was not fun at all.
Oh, so people were calling you out, and you were legally bound to not reply?
Well, I took it that way.
Okay.
Because I was a specific task force I was involved on, and as that task force, even though it's volunteer, you are perceived to be a voice of the state. So then it became very, very difficult to respond. Yeah, and that's So I guess the long way short is you just don't disengage. But I don't necessarily think that's the right way, to completely disengage. If people start piling on, I do think at some point you have to either ask the question or do a very soft introduction. So what is it about this that is challenging to you, or what do you find most scary about that? Again, those open-ended questions. But the best thing is if it just doesn't happen, because it sucks.
Yeah. It hurts. It's like, like when I get a 1-star Google review.
There was a pediatrician. We're now off topic on the COVID thing, but the pediatrician who did the TikTok video on vaccines, and then they started getting death threats. It was like, there's now organizations, from my understanding, that if physicians are posting something and the anti-vaccination crowd will get to them, you can reach out to them and they will help you with the social media part, because it can be very nasty.
Shots Heard, I think it's called. And I think the pediatrician that started that was Wolyn, Wolynn. I think, let me just double check that.
Yeah. It was real innocuous, just a happy little video, encourage people to get vaccinated or have their kids vaccinated. And it was turned into a horrible mess.
Yeah. Shots Heard, I think, is the name. If you end up on the other side of that, then just look up Shots Heard and you can, I think they'll help you out.
Mm-hmm.
Yeah. It's scary. Yeah. It's scary. I've been reluctant. I had an episode on Lyme disease, and let me know if we're getting too far off topic, but I had an episode on Lyme disease, and I was concerned about the chronic Lyme crowd finding it and like doxing me or something, even though, you can't really dox me. It's not really doxing if you can find all that stuff really easily, I guess. But I was worried about that. So I didn't post it on Twitter. Now, I haven't had any problems with anything else in any of the vaccine stuff that I've posted so far. I think just because my following isn't big enough that the signal just isn't reaching them yet. So, at one point, on the one hand, I'd like for my reach to be further, but on the other hand, that comes with a cost.
Yes.
And you're gonna have to deal with a lot of that.
Well, you already make me think of future episodes here, Brad, because I think that would be a fascinating one, to little talk about the rebound and what people have done when it comes to these issues where people have attacked you. And unfortunately, with the internet age, it gives everybody a reach, and unfortunately gives everybody a reach. So anyway.
Yeah. I mean, I know someone who had their Yelp reviews just trashed, absolutely trashed. Now, this person is like an academic faculty. They're mostly salaried. The patients were coming anyway. And because they work for university, I think the university was able to get involved. But like, for me in private practice, if someone decided to target me and just shred my online interviews, this is how a lot of people find me. And so it could really be very damaging.
Yeah. Well, I think that's the pros and cons social media. Like it can be good, but then it has its downside, and none of us want to be on the target for people's maliciousness.
Yeah. I even get sad when I get a 1-star Google review. It like ruins my whole day. The fact that someone came away from a visit with me and thought it enough or so little of me that they wanted to really.
Yeah. But it's the lens they're looking through. It doesn't mean that, there are definitely a few people out there that probably deserve reviews they get, but I think sometimes you get these occasional ones that the lens, the way they interpreted you from whatever life they've lived, however their canvas has been painted their whole life, they viewed that interaction as totally different. I know we got a little off topic, but I wanted to reel it in unless Kevin, you had anything else to say or questions.
I always have something to say.
I know.
Whether or not.
But I thought I just kind of, you kind of targeted a couple things on here about motivational interviewing kind of tactics. And there's a lot of different formats, not like this is the only way, but I just wanted to mention, like you talked about, especially when you're dealing with COVID vaccine and trying to introduce topics that you want to ask mostly open-ended questions to hear their story, potentially their fears, their interpretations, or understandings. Affirm their strengths is kind of what they mentioned here, but validate them and listen reflectively, maybe summarize kind of what you heard them say, and then kind of summarize a big picture, highlighting like the potential change or getting the vaccine, or if you do it now versus later versus not at all, like kind of, give them the whole big picture, and they can let you know what they're ready for. It might be a more effective way for us as a community to really engage people towards getting vaccinated. So did I summarize that well enough, Brad?
Yeah, that was perfect. Okay. Open awesome. And you listen, you acknowledge their concerns, you reflect them back to them, and then you summarize. And that, I think, with the summary, that's where you can kind of interject some of this is where the guiding happens rather than the pejorative dictating what they need to do. It's where this is where you steer the boat.
Right.
I like that.
Well, awesome. Well, it sounds like we might have a few other episodes coming up. I want to thank you again for being our guest, Dr. Block. And we love your interior design that your wife
thank you.
Nicely demonstrated.
Zhuzhed up my space a bit, yeah.
And it's a block letter, I notice, for your last name.
B for block, yeah.
Yeah, it's like special font there too. Well, great. Well, I really appreciate your time with us today. And for those of you that have not checked out thechangephysician.com, make sure to check out what we've got going on, be part of our newsletter. Even if you're not a physician, you're a physician ally, we would love for you to check that out. And also make sure to click on the link for the podcast for Dr. Block. He's got a ton of episodes. He's been doing this a little bit longer than us. So make sure to enjoy that. Kevin, any other last thoughts, or can I take us out?
You can take us out.
All right. Well, until the next episode and another episode with Dr. Block, I am Melissa Cady, the Challenge Doctor, with my co-host, Dr. Kevin Cuccaro, and we'll see you next time.
Take care.